is the same kind because you want this to be the hard part here. So there's a triple lumen. So I guess you will not use the same one, okay? Because there's another gadget. This goes with the art line. This is what you would use for the art line. But let's say a central line. Triple lumen, because there's 3 lumen, basically, right? Double, single lumen. So, and it will tell you here there's a proximal, distal, medial. What does that mean?
Proximal is closest to the patient.
Closest to the skin, that's right. So the outside, yeah. So this one, the proximal, that means it's closer. So basically, if you have this catheter, think of it. So if this is our insertion site, this is our exit site, I should say, in the skin. So the proximal will probably here, the medial, the distal. Okay? So just kind of need to visual what those mean. So yeah, proximal to the skin or to the exit site. So the same thing we would do with this is we, at the beginning, we will go ahead and do the level of the zeroing, and this is the yellow one. And it's always going to be the yellow, the red, so this is the standardization universal. Okay? You guys know what's a normal CVP?
Oh, we just learned.
Very, very low, but for the critical care, 0
to 10.
4 on there, yeah, very low. For normal one, but when we have a patient who's on sepsis, things like that, we definitely won't want that to be 4. So it's going to be higher anyways, huh? Huh?
What is the value?
Usually it's, 2 to 4 around there. So very low, but even with a 9, it's very low for a critical care patient. But it's, anyway, so that's that. And I think they'll learn it. Yeah, okay. So that's how you would level and zero that as well. Sometimes they would just use one bag and have a couple of transducers here. This one always clamp. Make sure your site is clean. If the patient's awake, sometimes there's, like we said, data, you always want to tell the patient what you're going to be doing, assess the site. Usually it's not going to be this kind of dressing. It's going to be where you can see them. So to see if there's any exudate there that you need to change on. Okay.
So you just clamp it when you're zeroing it?
No, you don't. Because otherwise, yeah. No. Let's say okay, there's 2. This is, okay, so this one is the IV fluid. Okay, so this one will, you can turn it off. But this one, of course, if it's infusing, you unclamp it.
Okay.
Okay, but if you're not using it, like this one, make sure it's clamped.
Okay.
Make sure you flush it with normal saline. Okay, and this one's always going to be open if you're transducing.
Okay.
Okay, I just turn it off when I use it for the art line. But
Okay.
usually they have their own.
Yeah.
Okay, so that's that. What else for the central line? If you do need to change them, it's sterile technique. Make sure you wear your mask, and then after the procedure, you document your procedure. Okay. Usually they'll have them. Hopefully now that they are going to be computerized, there's probably in their documentation system that I zeroed level and it's whatever. Okay.
There's a kit put together we need for. It has the bio patch and everything. You just get that, get your mask and gloves and your
Yeah. But make sure, don't do it by yourself. It's probably going to be with your nurse or me to do that. But definitely that's a sterile technique. Changing the dressing. No. The dressing, we don't, the dressing itself. We don't change the central line, that's a physician.
That's what I meant.
Dressing, yes. Yeah. Okay. Any question on that one?
Did you say that you level the central line too, or no?
The CBP. You have one that you're actually transducing. Okay, and you're looking at what central line, when you do central line, and I know you guys talk about preload, where are we measuring? Usually the preload, which is the right atrium. Yeah, that's where you're measuring, just to see if the patient is fluid depleted or not. So this is where you measure. It's through here. Okay, so this is also going to be, there's another one here. That's why there's multiple. So there's one for A line. There's one for central line. Okay, exactly like this, but we only have one setup, so I have to use kind of, but you don't use the same one for the 2. Okay, just kind of know that there's going to be one here, and this is going to be, and it's going to say CBP, A line, so you know which one is which.
And what do you
Okay.
level it with?
You level it again to the, same spot.
Oh, okay.
Same spot, okay, same spot.
Level up.
Yeah, all the same
But
ones.
it's
Yeah,
not
for the
the
central
spot.
line and A line. For the leveling, you level it at the fourth intercostal mid-axillary line. Okay? Okay.
Is the patient laying down?
If it's contraindicated for them to have, let's say, they have increased ICP that you might have to, but you still level it here. So if the patient's head is down, then this will probably come down some more, but you have to level it at that point. Okay, so if the patient's down, this has to come lower. Yeah, so let's, yeah, this is the old. So let's,
English, right?
okay. So usually it'll go
There's
back.
mud.
And for prevention of ventilator-associated pneumonia, you want your patient's head of the bed elevated at 45 unless it's contraindicated, correct? So see how this one is? Now look where this is. So if you put your patient's head down, look where this we're leveling. So you want to lower this, and this is, you unscrew it, and you level it, and then you do the zeroing again.
And you use a level.
A leveler. There's a leveler. There's one here. I don't know what happened.
It's just a yardstick
Yeah,
with
That's what I
a,
asked, because I
Uh-huh.
thought we were just gonna do that and put the level.
Oh, no,
but
no, no.
Yeah.
No, remember, but I'm just saying this is how there is a leveler. At CRMC, there's always one in each room. But yeah, there's a leveler, and at one point, critical care nurses actually have their levelers. But you level it to the point, so if you're adjusting the patient's head, moving them around, make sure that you also adjust this. Because otherwise, you're gonna get an incorrect reading there, and you may be treating something that you should not be treating. Yeah? Any question? Good question.
So to zero it, you just turn the stop clock towards the bag.
Not towards the bag, because when you turn it towards the bag, that means you're turning
wait,
it off
for
to
the
that side.
patient. Okay.
So when you turn the stop clock, and I know the stop clock is kind of, you have to kind of think a little bit about, when you're turning it off, let's say this pointing, you're turning this side off,
It's the red one.
okay? So when you turn the stop clock, you're turning this part off to off. So this is the patient right here. Let's see here. Oh, hold on. There you go. This is the patient. So when you turn it off to the patient, okay, so that's the
Okay.
patient. So just kind of, and always.
to the patient?
Yeah. So when you look, see, it's right here. So, okay. There you go. To the patient. So always want to go this way. Sometimes you have a lot of tubes, so make sure that where that is. Okay. Other people actually have a different setup than this. So that's that one. Yeah, it's usually this. So it's not usually that. Yeah.
So
it's-
which way do you
and you
turn it?
know, okay, so that one is
so
to the back.
The patient.
Okay. So going down would be to
Up.
I would wanna, be careful as far as down and up. Some nurses might wanna do it this way, okay? Sometimes I find it this way, so you need to know, you really need to locate. But sometimes I find it that way and you think you're turning it up or down or not. But just always for me is, so even though you have different kind of equipment, outdated equipment, just always trace it to the patient and which one's the tube. But usually the hard, okay, yeah. Because sometimes this is not, I don't see this. This is what we have. Okay? Any question on that one?
So you turn it off towards the patient, you unscrew the little cap.
Uh-huh. Then you zero your monitor, and it will tell you zero, so you're zeroing and negating the atmospheric pressure. So
Okay.
when what you're monitoring after everything's said and done is basically the patient's pressure,
Okay.
okay?
And you check and make sure the pressure is good. You put a new cap on, you pull the little thing to get the waveform.
Uh-huh, yeah.
And then that's it.
Mm-hmm.
Okay.
Mm-hmm. Yeah, if you see this one on top,
Mhm.
I usually say, that's not right. Usually the picture will be at the bottom.
Okay.
Okay? Any question on that one? I want to make sure that these are all kind of, actually capped. And this one's capped. Question on that one? Anything else that they have? After you have done this for a long time, it's like, okay, are we forgetting something? I don't want to. Okay.
Is she doing this whole thing?
Limit, the limits.
Yeah, like
Oh,
she
she'll
puts
talk
the
about the